Hi, hello everyone. Hi, hello everyone. Welcome to Farre Series. Hi, hello everyone. Yes, I'm audible. So, we are discussing one very important topic today, medical jurisprudence. So, in medical jurisprudence, the important topics are legal procedure and medical law and ethics. So, in this session, we are discussing some important questions, especially short essays and the short answers from this medical jurisprudence. Yes, am audible and visible, everyone? Dheeraj Chaurashia, namaste, Dheeraj Chaurashia. Am audible and visible? Audio video, is it clear? Is it clear? Okay. One very important question, very commonly asked in your university exam, is medical negligence. So the question can be asked, define medical negligence, mention 4D elements, explain differences between civil negligence and criminal negligence. Very frequently asked 5 marks question, or it is long essay, that is 10 marks question, and very frequently asked 3 marks question. Okay, fine, Dheeraj. So define medical negligence. Mention 4D elements. What do you mean by 4D? Duty, dereliction, direct causation, damage. Difference between civil and criminal negligence. So what are the differences? So 5 marks question. So the 1 mark basically for definition, the 2 mark basically for 4D elements. Differences can be 2 marks. Okay. Let's define medical negligence. What is medical negligence? Definition from standard textbook Case and Reddy. Medical negligence defined as absence of reasonable care and skill or willful negligence of a medical practitioner in treatment of patient which causes bodily injury or death of the patient. Okay, so this is the standard definition. Let's discuss some important concept in the definition. Absence of reasonable care and skill. Absence of reasonable care and skill. So as you know, every doctor should have some knowledge about the disease and the treatment. That should be reasonable enough to take care of the patient. Reasonable care and the skill. Let's say example, a case of burn injury. A case of burn injury. As you know, the most common cause of death is hypovolemic shock, which is the immediate cause of death. Anybody, what is the reasonable care and skill in a case of burn injury? Dheeraj, we are talking about definition, and we are also defining about the important concept in definition. What is the reasonable care in burn injury? Anyone? Dheeraj, I said burn injury. Say example, a patient came with a history of multiple burn injuries, around say 20% or 30% burn, maybe dermoepidermal burns, first degree, second degree, third burn, as you know. So what is the reasonable care when a patient came with a history of burn injuries? Anybody? Yes, very good. Sumana De, it is the IV fluid. Very good. IV fluid. So, as a doctor, you should exercise reasonable care and skill. Like example, burn injury, immediate treatment is giving IV fluid. Okay, so that will prevent hypovolemic shock. One more example. Say example, snake bite. Say example, there is a case of poisonous snake bite. Patient came with a history of respiratory difficulty, ptosis, abnormally sleepy, and also is having convulsion. Probably a neurotoxic snake bite. What would be the reasonable care in a case of snake bite? Anybody? Snake bite. Sumana Dei. So we are discussing definition. Reasonable care and skill. The examples are, one is burn injury, IV fluid. Snake bite, what is reasonable care? Yes, Sumana Dei and others. Can you answer this, guys? Can you answer? Snake bite. So the common snakes are common krait, common cobra, Russell's viper and saw-scaled viper. They are known as big four snakes of India, or big four poisonous snakes in India. So whenever the history of snake bite, what would be the reasonable care or skill that you should exercise in treatment? Yes, your answer should be yes, antitoxic. No, it is the antivenom, polyvalent antivenom. Antivenom it is. So this is the meaning of reasonable care and skill. So when doctor, while using reasonable care and skill, so then it is not a medical negligence. So absence of reasonable care and care and skill is a medical negligence. Willful negligence. So when doctor is willfully negligent in treating patient, leading to bodily injury or death of the patient. So death of the patient. So here comes is one very important MCQ that can be asked in your exam. Medical negligence leading to death of the patient is punishable under 106 BNS. Okay. So remember this, 106 BNS. 106 BNS is equal to 304A IPC. Okay. So previously it was IPC, Indian Penal Code 304A. Now it is 106 BNS, Bharatiya Nyaya Samhita. So this can be asked in your exam with an MCQ, an update. The punishment can be 2 years of imprisonment. So 2 years of imprisonment. So Dheeraj, BNS means Bharatiya Nyaya Samhita. It is a code related to offences and also the punishment. So BNSS is Bharatiya Nagarika Suraksha Samhita, BSA, that is Bharatiya Saksha Adhiniyama. We discussed many times in YouTube classes as well as in live classes. Remember, 106 is nothing but medical negligence. The punishment can be up to 2 years of imprisonment. Yes, okay. Now we are discussing about 4D elements. So what are 4D elements related to 4D elements? The 4D elements of medical negligence. So can anyone answer? What are 4D elements of medical negligence? What are 4Ds? Anyone? What are 4D elements? Okay, Sumana De. Okay, fine. So 4D elements, say example, doctor and patient. I know. So what are the 4D elements of medical negligence? That is absence of reasonable care and skill or willful negligence. So what are 4D elements in proving medical negligence? So every D that start with the D. So that's why the first thing, damage. Okay, good. Relay answered, sir. It is damage. Direct causation. Very good, relay. Excellent answer. So first thing, remember, when doctor and patient, you should establish, or the court should establish, duty of care. Okay, the first thing, there should be duty. Okay, duty should be established between patient and the doctor. So doctor should be on duty that particular day, and also he must have that duty of care between patient and the doctor. The first D is duty. Second, dereliction of duty. Okay, dereliction of duty. Dereliction means it is can be an act of commission, or act of omission, dereliction of duty, that means negligence of the duty. Either it can be act of commission or act of omission. Okay, doing something which was not needed, that is the act of commission. Not doing something which was actually needed, that is the act of omission. Like example, a case of snake bite, the treatment of choice, a reasonable care is the anti-venom. When anti-venom is not given, that is the act of omission. Not doing something which was actually required, that is the act of omission. Okay, or it can be act of commission. Okay, yes, good. Sumana, they answered duty, dereliction, yes, direct causation. Okay, direct causation. Direct causation. So because of the doctor's negligence, because of the absence of reasonable care and skill, so the damage has occurred in the patient. So either it can be bodily injury or it can be death of the patient. That is a direct causation. So one example is leaving swab in abdomen. So leaving swab in abdomen. Okay. So leaving swab or instrument while doing operation. So that can lead to septicemia, that can lead to perforation and death of the patient. So direct causation, because of the act of the doctor, so there was an injury or there was a death of the patient. Lastly, there is a damage. So damage can be death of the patient or it can be some bodily injury. So what are 4 Ds? The 4 Ds of medical negligence can be, the one is the duty. So you should establish, or court should establish, a duty of care between doctor and the patient. Second thing, dereliction of duty. So that means absence of reasonable care and the skill. Either it can be act of commission or act of omission. So or it is one more, direct causation. D for direct causation. Like example, leaving swab in the abdomen, which is known as recips or locator, or it is facts speaks for themselves. So leading to septicemia and death. So that is a direct causation when doctor is involved, because of the doctor negligence. So the negligence happened, or the death of the patient happened. Lastly, that is the damage. So all these are the 4D elements. So in exam, professional exam, you need to define properly what is medical negligence and also 4D elements. So Aditya Tiwari. Okay. Yes, Aditya Tiwari. Sumana De. Have understood the definition and as well as the 4D elements. And also you need to remember, medical negligence is punishable under 106 Bharatiya Nyaya Samhita or 304A IPC Indian Penal Code. Yes, everyone should write 106 BNS in the chat box. Write this in the chat box so that you can interact with me. Just write 106 BNS, Bharatiya Nyaya Samhita, in the chat box. So that is the punishment, that is going to define punishment for medical negligence. Yes, everyone keep writing, then we'll go ahead. Sumanade and others, keep writing 106 BNS in chat box. Sumanade, Aditya Tiwari, Avi Suryamsha, relay, very good, relay, very good, very good. Chalo. Now here I am giving an example, just an example, just to explain the medical negligence. So here is the patient came with a history of OP poison, that is the organophosphorus poisoning. So the patient is having a bradycardia, patient is having salivation, respiratory difficulty. So what is a reasonable care in OP poisoning? Anybody? So this patient is having signs and symptoms of organophosphorus poisoning. Organophosphorus poisoning. So what are the features of organophosphorus poisoning? Basically respiratory difficulty. So what is the reasonable care in OP poisoning? Anybody? Anybody? This patient is having difficulty in breathing, is having salivation or lacrimation, respiratory paralysis. So all this. So also there is a consumption of some amount of OP poison, like example malathion, parathion and all. So what is the reasonable care? Yes, your answer should be, that is A, B, C. So you need to maintain airway, B for breathing, C for circulation, D for drug, that is your atropine. Atropine is the drug of choice. So atropine is the drug of choice, 2 to 4 milligram given intravenously, that is going to antagonize the action of OP poison. So and also reverses the signs and symptoms. Atropine, very good, good answer. Now, so 4D elements we discussed. Next is the types of medical negligence. Types of medical negligence. So remember, there are two broad categories of medical negligence. There are two broad categories. The first one, civil negligence. The second one is criminal negligence. So what is the first? Civil negligence. Let's discuss each one in detail. Civil negligence. The second one is criminal negligence. Criminal negligence. What is the difference between civil and criminal negligence? Remember, in civil negligence, it is the civil court or the consumer court going to handle the case. In criminal negligence, the criminal court that is going to handle the case. That is the basic difference. Civil, basically in the civil court, here the patient, they ask for the compensation. In criminal negligence, the case is between state and the doctor, and here the punishment is imprisonment as well as the fine. Okay? So remember, criminal negligence, basically that is your 106 BNS. 106 BNS. Criminal negligence, basically consumer court. So consumer court. Yes guys. So now the first point in exam you need to write, civil negligence is simple absence of care and skill. Simple absence of care and skill. It's a simple absence. So because of the simple absence of care and skill, there was a damage in the patient. Okay. So that is civil. But in criminal, gross negligence, gross carelessness, because of the doctor's carelessness, which is very gross in nature, there was a damage in the patient. Like example, doing operation on wrong side. So the patient is having some tumor on the right side and he was operated by the doctor on the left side. So wrong side. So that shows that doctor is grossly negligent. Any other example for gross negligence? Anybody? Sumanade, relay, Avishura Amsha, Sumande. Gross negligence. We're talking about gross negligence. So what is the one example for gross negligence? Anyone? Come on, Sumanade, relay. Everyone should give an example for gross negligence. So, what is that example? One I said wrong side. Any other? Any other guys? Any other example? Yes. Let's think and answer, guys. Try to answer. Let's discuss. Let's interact each other. Wrong side. Okay. Wrong patient. Wrong patient. Yes, this can happen. Wrong patient. Wrong side. Then wrong blood. Anything that is blood transfusion. Mismatched blood transfusion. Mismatched blood transfusion, which is definitely gross negligence, because it can lead to severe antigen antibody reactions and can lead to kidney failure and death of the patient. It can be an example for gross negligence. Wrong amputation, very good. Wrong amputation. So, right and left, very good. Then, any other example? Like example, applying tight plaster, very tight plaster, leading to paralysis of the limb. Yes, so plaster can lead to some degree of numbness, but applying very tight plaster, cast, leading to paralysis of the limb can be a gross negligence. Any other? Relay, anybody? Any other example, guys? Any other example? I said wrong side, wrong patient, mismatched blood transfusion, and also I said about the very tight plaster, a cast leading to paralysis. For example, any other one example, guys? Prescribing wrong medication. Okay, Arshad Sham answered, sir, prescribing wrong medication. Good. Wrong medication. So, which is actually not required in that particular case. Very good. Any other example? Leaving swab. Say example, a gynecologist or say surgeon leaving swab in the abdomen, some instrument in the abdomen. So, that can be gross negligence. So, retained swab. So, retained swab or surgical instrument can be a very gross negligence, that can be criminal negligence, punishable under 106 BNS. Punishment can be 2 years of imprisonment. Yes. Okay, fine. So, allergy, anaphylaxis, again remember, so there is no clear cut line between civil and criminal. Any case can be civil, any case can be criminal. There is no clear cut guidelines between civil negligence and criminal negligence. It all depends on the case. It all depends on each case. Okay. So, 5 example, if you write an example, more than sufficient in your exam. One is the wrong side, wrong patient, mismatched blood transfusion, plaster and retained swab. Fine. No civil negligence example can be some mild injury to the patient, maybe a wrong diagnosis, can be civil negligence, right? No special violation of law. No special violation of law. So, we have certain law related to medical practice, like example, medical law and ethics. But in civil negligence, there is no special violation of the law. But in criminal negligence, willful, wanton or even culpable negligence. Willful, wanton or even culpable negligence, because there is a clear violation of the law. Clear violation of the law. Okay. So, like example, giving mismatched blood transfusion leading to death of the patient, there is a willful negligence. I know cross matching should be done before giving blood. So, that is what the willful negligence. Reception locator, very good. Tried by civil court. Civil court, nothing but your consumer court. Consumer court. Consumer court. The punishment is fine. So, it can be lakhs, it can be crores also. So, there are cases where the compensation given more than 5 crore, okay, 5 crore, 6 crore, 10 crore, like that. So tried by civil court. Basically punishment is the compensation, monetary compensation. Tried by criminal court, criminal court can be session court, magistrate court, first class, second class, hai na, so or high court, hai na, criminal court. Consent of the patient amounts to good defense. So consent, very very important. So consent taken from the patient is a good defense. Good defense. It is going to protect the doctor in civil negligence. Civil negligence. But remember, the consent of the patient is not an adequate defense in criminal case. In criminal case. So as you know, consenting age in any medical procedure is 12 years, any surgical procedure 18 years. So consent taken for a particular procedure or a particular operation, it is a good defense in civil negligence. But remember, when there is a gross negligence or criminal negligence, consent is not a good defense. That is not going to protect you from imprisonment. So this is what you need to understand. Okay, Kushi Garg, what are bioethics in patient care? Okay, good point. Next, contributory negligence. Anybody, what is contributory negligence? Can anyone answer? What is contributory negligence? Contributory negligence can be defense in civil negligence, but not in criminal negligence. So this is the one more point you need to highlight in the exam. So my question now, what do you mean by contributory negligence? Anybody? Sir, contributory negligence is a condition in which doctor is also negligent, patient is also negligent, both are negligent. When doctor, patient both are negligent, when the both are contributed in negligence, that is contributory negligence. So we'll discuss again one example in upcoming slide. So time being, remember, contributory negligence is a negligence contributed by both patient and the doctor. Very good defense in case of civil negligence. Liable to pay damage. Okay guys, any doubt in this? Any doubt? Okay. Yes. So we discussed about criminal negligence. So what are the example? So criminal abortion leading to death can be criminal negligence. Surgery in wrong extremity or wrong patient can be criminal negligence. Leaving swab or instrument can be criminal negligence. Operation without consent can be criminal negligence. Too tight plaster leading to gangrene. Death of patient due to negligence. All these are example for criminal negligence. Now all of you try to answer this. Look at this newspaper headline and identify whether it is a civil negligence or criminal negligence. Anybody? Can anyone answer this? Doctor accidentally amputate wrong leg an elderly patient in tragic mistake. What it is? Civil or criminal? So Rishikesh, yes, good. Criminal. Criminal negligence. What about this? Wrong patient. Civil or criminal? You need to type either civil or criminal. Very good. Criminal. Criminal. Good. What about this? Instrument in the abdomen. Okay. It is also known as receptor locator. Receptor locator. Is it simple absence of reasonable care or it is criminal negligence? Civil or criminal? Yes. So it is a fact speaks by itself. So it's a criminal negligence. So what would be the punishment, guys? So what would be the punishment in this case? Can anyone answer? Can anyone answer? Sumana De, Rishikesh, Relay, Kushiga, what would be the punishment? In this particular case, were operated by some surgeon and some instrument or some surgical instrument or swab which was found in the body leading to perforation, leading to septicemia or sometime death of the patient. So what would be the punishment? What would be the punishment? Yes, come on, try to answer, guys. So the punishment can be 2 years of imprisonment as per 106 BNS. 106 BNS. Very good, really. Very tight plaster leading to paralysis. So very tight plaster leading to paralysis of the limb. So is it a criminal negligence or civil negligence? Civil negligence. Paralysis means paralyzed limb, guy. Paralyzed limb, upper limb, lower limb, upper limb, lower limb paralyzed. So leading to disability. Imagine someone with paralyzed limb like polio. So right or left limb or upper limb or lower limb. Is it a criminal negligence or civil negligence? It is not just a numbness. It is not a temporary paralysis. Permanent paralysis of the limb. Is it civil negligence or criminal negligence? So Rishikesh now, Rishikesh. Okay, it's a criminal negligence. Good. Chalo. Look at this now newspaper headline, try to answer. Doctor, nurses convicted for medical negligence. So around 6 months. So is it a civil negligence or criminal negligence? Simple only. Is it civil or criminal case? Conviction is there. When word conviction, when it is handled by criminal court, when the punishment is imprisonment, it must be criminal negligence. In civil negligence, only compensation. Okay? Yes. Criminal negligence. Good. So this is about the medical negligence question. So all of you have understood? Any doubt in this? Shall I move ahead? Say yes or no in the chat box. Have understood definition? Have understood 4D elements? Differences between civil and criminal? Have understood? Now identify this negligence. Doctor applies tight plaster cast on patient leg. So tight plaster. So doctor is negligent. But instruct the patient to report numbness. Patient develops numbness in his toes, does not inform the doctor, patient is also negligent. So, patient is also negligent. So, what type of negligence is this? What type of negligence is this? Sumanade, Rishikesh. So, this is contributory negligence. Contributory negligence. I said contributory negligence is a very good difference in civil negligence. One more example. Doctor prescribes drug, a particular drug, maybe an antibiotic or paracetamol, any drug, fails to inform the patients its side effects. The patient starts getting some side effects, fails to inform the doctor, suffers injury. So, what type of negligence is this? What type of negligence is this? This is again contributory negligence. Contributory negligence. Okay. So, this can be a 3 marks question. Define contributory negligence. Give one very good example. You can write same definition we discussed in the class. You can write the same example. You will get 3 out of 3. Okay. Yes. So, next heading, explain about infamous conduct. So, this can be a 5 marks question or it can be frequently asked 3 marks question. Infamous conduct. Infamous conduct. Anybody can answer what do you mean by infamous conduct? Anybody, can you define infamous conduct? Or professional misconduct in relation with the medical practice? Anybody, what do you mean by professional misconduct? It also comes under medical malpractice. You know, medical malpractice has 2 components. One is the professional misconduct, second one is the professional negligence or medical negligence. So, both comes under malpractice. Now, look at this now. What do you mean by infamous conduct? There is a nice picture taken from, it's also explained in some of the movie, I think Arjun Reddy movie. Have you seen that movie, Arjun Reddy movie? What do you mean by infamous conduct, guys? Have you seen that movie? Disgraceful, dishonorable act of the doctor. Very good, Sumanade, excellent answer. Disgraceful. Okay, dishonorable conduct of a doctor. Very good. So, disgraceful conduct of the doctor. Treating patient under the influence of alcohol, treating patient under the influence of addiction can be a disgraceful conduct, and also dishonorable conduct. Dishonorable. Okay, conduct of a doctor, but remember, whether it is disgraceful or dishonorable or it is normal conduct of the doctor, that is decided by professional men only. It is decided by the doctor, fellow doctor. Okay, so you can define in exam. So, infamous conduct is a conduct of a doctor which is basically a disgraceful or dishonorable conduct. Because of that, there can be a damage to the patient. Okay, so you can write like this in exam: disgraceful, dishonorable, unethical behavior as judged by the professional men of good reputation and competence. Okay, competence, that is very important. So, doctor should be competent enough while treating the patient. So, disgraceful, dishonorable, unethical behavior judged by professional men of good reputation and competence, known as professional misconduct. So, you can remember like this: 6 A's. 6 A's of professional misconduct. The first one, A. So, every conduct starts with the A. So, A for association with unqualified person. Association with unqualified person. So when doctor is associated with unqualified person, unqualified other doctor or unqualified person or unqualified nurse or someone while treating patient or while handling patient, that is a infamous conduct. It is known as covering. So this can be asked in your exam. What do you mean by covering? When doctor is involved, when doctor is associated with some unqualified person while treating patient, that is known as covering. Try to remember this. Okay. What do you mean by dichotomy? Anybody? Anyone, guys? What do you mean by dichotomy? Dichotomy. Try. Interact with me. Yes, guys. Dichotomy. What do you mean by dichotomy? Dichotomy means fee splitting. Fee splitting. Okay, fee splitting. In other words, you can say it is taking commission or giving commission. So, in relation with the medical practice. Say example, the doctor is taking 500 rupees from a patient and he is giving some 200 rupees to the agent. So, agent one who bring the patient to his hospital. So, this type of behavior, this type of conduct of a doctor is known as dichotomy. Taking commission or giving commission, that is punishable offense. Okay. Fee splitting, very good. I said no, 500 rupees, 200 to the agent, 300 to the doctor, or 200 to the lab person, taking commission from the lab person. So that is also known as dichotomy. So this is first A. So A for association with unqualified person, known as covering, and also involvement of commission and giving commission, taking commission, that is known as dichotomy. Then advertisement. Repeated advertisement in TV, newspaper, repeated advertisement about the hospital, about the doctor, involving patients, before treatment, after treatment. So all this comes under infamous conduct. So as per NMC rules, National Medical Commission, repeated advertisement like giving offers, 1+1 offer, like that. So large signboard everywhere in the city, large signboard about the doctor, advertisement about manufacturing of drugs or manufacturing firms can be a professional misconduct. Yes, contribution, yes, is not contribution, you can say it's bribe also, contribution to others. Yes, that is what the fee splitting. So advertisement, fine, but remember, doctor can do advertisement in certain cases. Can you give example when can doctor advertise in newspaper or media or TV? Anybody? What are the conditions in which he can do advertisement? Definitely he has a right to do advertisement. So what are indications? Anybody? Anyone? In certain condition, doctor can do advertisement. My question is, can you give an example for advertisement which is legal? Legal as per NMC. Yes, come on. Yes, anybody? About vaccination, okay, fine, vaccination, good. While opening a new hospital, a new clinic, so he can do an advertisement. Or while changing the hospital venue, or while closing the hospital, so or when he is starting some new instrument, so a new CT scan, a new MRI machine in a particular hospital, so he can do advertisement. So the advertisement should be as per NMC norms, so that you will come to know once you go through the NMC norms of the advertisement. Okay, yes, fine. Next, adultery. A for adultery, basically So that is misconduct with the patients. Okay, adultery, misconduct with the patient, especially sexual in nature. Abortion, illegal abortion, A for abortion, illegal abortion without any indication. You know, there are indications for MTP. So there are maternal fetal indication, eugenic indication, humanitarian indication. So anything that is done, abortion, illegal abortion, criminal abortion, without any proper indication, without any proper guidelines that is given any in the MTP Act, can be illegal abortion, can be infamous conduct. Next, A for, that is addiction. It can be alcohol, it can be drug addiction. So alcohol, yes. So in exam, when question asked, what do you mean by professional misconduct, you need to write like this: disgraceful, dishonorable conduct of a doctor decided by professional men of good reputation and competence. It can be remembered with the help of 6 A's. What are 6 A's? A for association, A for advertisement, A for adultery, A for abortion, A for addiction, A for alcohol. Okay, so this is about the professional misconduct. Anybody, so what is the punishment in case of professional misconduct? What is the consequence or the punishment given by State Medical Council or the National Medical Commission? Basically, it is State Medical Council. What is the punishment? Can you guess, guys? Can you guess? Relay, Sumanade, Rishikesh. What is the punishment? Or what is the action taken by State Medical Council? Like example, Karnataka State Medical Council, Tamil Nadu State Medical Council, Delhi State Medical Council. What would be the action taken by State Medical Council in a particular case of professional misconduct? Anyone? Suspension of the degree. Very good. Warning, suspension, penal erasure. Very good. So either it can be warning. So the warning can be given by State Medical Council, SMC, State Medical Council, or it can be suspension of the degree, suspension of the license, basically suspension of the license for a particular period, maybe 6 months or 1 year, temporary suspension, or it can be professional death sentence, that is permanent erasure of name of doctor from the medical register, that is known as professional death sentence. So this is the action that can be taken by SMC or State Medical Council. Okay, erasure. Good answer. Good, Rishikesh. All answer. That is fine. Now, yes, have you seen this movie, guys? Just remember, when question asked infamous conduct or professional misconduct, 6 days try to remember. One very famous movie is Arjun Reddy movie. Hai na? Arjun Reddy. Say, okay. Next, one more question, very frequently asked. Types of inquest. Types of inquest. Okay. Okay, guys, have you understood this? Any doubt in this 3 marks question? Any doubt? Say yes or no, Rishikesh, Sumanade and others. So we'll go ahead with some more questions, especially from legal procedure. Then we'll stop the class. Okay. Any doubt in this professional misconduct? Any doubt? Okay, Sumanade. Okay. Rishikesh. Okay. Types of inquest. One very, very commonly asked question. Define inquest. What are types of inquest? Explain in detail about police inquest. What are the indications for magistrate inquest? Very, very commonly asked question in your prof exam. More than 10 times in last 5 years. Can be a 5 marks question, can be a 3 marks question, can be MCQ that can be asked. Okay. So, types of inquest. So, the first one, what do you mean by inquest? The inquest means enquiry. So, what do you mean by inquest? Enquiry. Enquiry it is. So, enquiry about what? Identity of the victim, especially in case of unknown dead body. Identification is very important. Sometime place of crime, time of death, and also cause of death. So, it is defined in standard textbook. Inquest is enquiry towards cause of death. Not only cause of death, in some cases identification, sometime it is about the place of crime, sometime it is time of death as well. Like in case of hanging, like in case of strangulation, like in case of poisoning, snake bite, drug addiction. So, it can be done in unnatural death. Okay, any unnatural death. Unnatural death. Okay. Unnatural death. Unnatural death. So, there are four or five types of inquest, but in India only there are two types of inquest. One is the police inquest, second one is the magistrate inquest. So, what are types of inquest? One is the police inquest. So, police inquest. Yes. So, can you give one example? Can you give an example in which police inquest is done? So, police inquest conducted by police officer known as investigating officer, IO, investigating officer, which is the commonest inquest in India. Commonest inquest in India. So, can you give an indication for police inquest? Can you give an example for police inquest, guys? So, in police inquest, police officer, investigating officer, either sub inspector or head constable or ASI, they do visit the crime scene. They will try to identify identity of the person, place of crime, time of death. Sometime also they ask the doctor to find out the cause of death. So, that is the police inquest. The police inquest basically Panchanama, we call it as Panchanama. It is about the circumstances of the particular death or unnatural death. It is the commonest one. So, can you give one example for police inquest? Anybody? Murder. Okay, very good. So, it is the murder, a case of murder. Good answer. Very good answer. Case of murder, or sometime case of suicide. Okay. Or it can be one more common, guys, road traffic accident. Medical negligence, road traffic accident, a case of murder, a case of suicide. All these are the indications for police inquest. So, the investigating officer usually sub inspector. So, the inquest report commonly known as Panchanama, and also the police has to inform the nearby magistrate within 24 hours. Okay, police inquest, which is the commonest inquest in India, but is inferior to magistrate inquest. Okay, yes, good. Now, dowry death, remember, dowry death is an indication for magistrate inquest. It is not for the police inquest. Okay, fine. Second type, magistrate inquest. Before that, try to understand police inquest comes under, police inquest defined under, discussed under 194 BNSS. Try to understand this. This can be an MCQ. Police inquest comes under dash section of Bharatiya Nagarika Suraksha Samhita. Your answer should be, sir, 194 BNSS. or 174 CRPC, 174 CRPC, or it is 194 BNSS. So all of you write 194 BNSS in the chat box. Keep writing. Keep writing, guys. Sumana De, Relay, everybody keep writing 194 BNSS. Bharatiya Nagarika Suraksha Samhita. Okay. So this is what you need to write. Some points, 3 marks or 5 marks. Next is the magistrate inquest. Magistrate inquest, which comes under 196 BNSS. 196 BNSS. Magistrate can be judicial magistrate, or it can be executive magistrate, judicial magistrate, JM, judicial magistrate, executive magistrate, EM, executive magistrate. Like example, executive magistrate, AC or DC, Tahsildar, usually Tahsildar, executive magistrate. Okay, 196 and 194 both are very commonly asked. So what are the indications of magistrate inquest? So what are the indications? Anybody? What are the indications? So what are the indications of magistrate inquest? Come on guys, what are indications? Try to answer now. Relay, Sumana De, Rishikesh. What are indications? Where executive magistrate, a Tahsildar or the judicial magistrate are going to handle the case, going to investigate the case. So they are the investigating officer. Anyway, the police are working under them only. So investigating officer, leading officer, basically magistrate. Okay. Indication. What are indications? Yes, very good, Sumana De. Excellent answer. Custodial death. Custody death. Very good. Custodial death. Custodial rape and murder. So one example. Second example, dowry death. Dowry death comes under 80 BNS. 80 BNS. 80 BNS. Dowry death. Any other? Beta, anesthetic death relay, it comes under police inquest. Anesthetic death. Okay, police inquest. Any other? Exhumation. Exhumation. Digging out of dead body from a grave. Digging out the dead body from the grave for second autopsy or first autopsy. So that is exhumation. For exhumation, indication is magistrate inquest. So then, death during police fire. Police firing. Okay. One more is there. Anybody? One more is there. What is that? One more example, guys. One more indication for police inquest. So death of a patient in a psychiatric hospital. Okay. So in psychiatric hospital. Psychiatric hospital. So 5 if you write more than sufficient. So what are the indications, sir? Custodial death, dowry death, exhumation, death during police firing, psychiatric hospital death, probably a schizophrenia patient, depression patient. So depression is a common cause for suicide. So suicide is very common. That all comes under. So that is the magistrate inquest. Okay, guys, I've understood. So this is how you should answer. So other types also there, like example, medical examiner's inquest. Medical examiner's inquest, which is prevalent in US. Coroner's inquest, which is not prevalent in India now. It was there till 1990, I think 99 in India, coroner's inquest. One more is there, a procurator fiscal system, that is prevalent in Scotland. So there are basically 5 types mentioned in the book: police inquest, magistrate inquest, coroner's inquest, medical examiner's inquest. Last one is procurator fiscal system, that is discussed many times in Sushruta classes. Okay, there are 5 types. But 3 marks question, when the question asked You can write like this. So, inquest is an inquiry towards cause of death or sometime identity, place of crime or time of death. So, police inquest is the most common inquest, comes under 194 BNSS. Magistrate inquest is the superior inquest than the police inquest, comes under 196 BNSS. What are the indications? There are 5 common indications. Other types also you can write in the exam. So, have you understood, guys? So, have you understood all this? Yes, guys, have you understood? Okay. Okay, guys, say yes or no. Yes or no, guys. Okay. Yes. And next question and the last question is about the components of recording of evidence in court of law. One more very frequently asked question. So, recording of evidence in a court of law. What are the components basically? So, that can be a 3 marks question or it can be a 5 marks question. Okay. Recording of evidence. So, recording of evidence in court of law. Okay. Anybody can answer? What are the components? What are the components of recording of evidence in a court of law? Yes, anybody? Anybody, guys? Come on, come on. What are 5 components? What are 5 components of recording of evidence in a court of law? Before that, you need to identify these important characters in recording of evidence. Okay. Yes. So, judge, judge. So, let me write. So, judge. Okay. Try to understand the concept, guys. Judge. Say defense lawyer, defense advocate, defense advocate, public prosecutor, public prosecutor, public prosecutor. So, my question is, guys, what are the 5 characters in what are the 5 important components of recording of evidence? Yes, come on, guys. What is the first step in court of law? What is the first step in examining witness in court of law? We have 3 important characters: judge, honorable judge, my lord judge, public prosecutor, government advocate, especially in criminal case. So, the public prosecutor. So, okay. Next, defense lawyer. So, the party of the accused. The party of the victim is usually public prosecutor. The party of the accused, probably a case of murder, medical negligence, rape, any case. So, it is the defense lawyer. Defense lawyer, basically the advocate of the accused or the defense person. Okay. Anybody? What is the first step? The first step, as you know, the first step, that is the oath. Oath. Second, examination in chief. Examination in chief. Examination in chief. Cross examination. Cross examination. Re-examination. Re-examination. And questions by the judge. Questions by the judge. Okay. So, there are 5 components: oath, examination chief, cross examination, re-examination, and question by the judge. So, this is very frequently asked in the exam. Now, anybody can answer oath is not required in certain condition. Can you tell me one condition in which oath is not required? Anybody? Anyone? Oath. Come on, guys. So oath is not required in children less than 12 years. Okay. So children's less than 12 years, the oath is not required. Child less than 12 years. 12 years. Oath is not required. Now the question can be asked in your exam, what do you mean by perjury? Perjury is giving false evidence in court of law under oath. Okay, giving false evidence under oath in court of law is known as perjury. That can be a 3 marks question. So perjury can be a 3 marks question. So perjury is a punishable offence under 193 IPC. It defined under 191 IPC. Okay. Yes. The second one, examination chief, usually conducted by public prosecutor. Leading questions are not allowed. Leading question means yes or no type of questions. They are not allowed in examination chief, usually by public prosecutor, just to explain the facts of the case to the court, that is examination chief. Then comes his cross examination. The cross examination usually conducted by defense lawyer. Leading question can be asked. There is no time limit for cross examination. So this can be an MCQ. What is the time limit for cross examination? Your answer should be no time limit. Then re-examination. The re-examination again by public prosecutor, just to clear the doubts that happened during cross examination. Lastly, questions by the judge. So there are 5 steps. So there are 5 steps related to recording of evidence in a court of law, especially while recording the statement from the witness. The first one is the oath, second one examination chief, then cross examination, re-examination, lastly the question by the judge. So this is what you need to write in the exam. 3 marks question, that is fine, more than sufficient. Okay, so this is about our Farre series. So we discussed some important questions today. So basically we discussed about medical negligence, infamous conduct, and also we discussed about the recording of evidence in a court of law, and also some questions about contributory negligence, and also about the inquest. Okay, any doubts, Sumanade? Any doubt you can ask me? Any doubt you can ask me? Yes.